There are a lot of conditions and symptoms that can arise in the conjunctiva of an individual. Conjunctiva, as we all can recall, it is basically the membranous layer at the bulbar margin as well as at the palpebral margin, and it is basically the outermost covering of the eyeball. It has the maximum exposure, so any irritant can cause the irritative purposes on the conjunctiva, which can result in a range and a variety of symptoms of the conjunctiva. Whenever we are just looking at any patient who has come up to you with grittiness in his eyes or any foreign body sensation that he's complaining of, and you look at the conjunctiva of the individual, you can just observe that there will be hyperemia in the conjunctiva. Then there can be chemosis, that is basically the inflammatory condition of the conjunctiva, as well as there can be the ecchymotic conditions of the conjunctiva, which basically relates to marked redness of the conjunctiva. All of these are the normal symptomatologies of the conjunctiva, and one should know how to relate to these symptomatologies and how to basically get to the final diagnosis in a particular individual. Over here, the most common presentation relating to the symptomatologies of the conjunctiva is the hyperemia of the conjunctiva. As the word indicates, it's basically the reddish discoloration that the conjunctiva gets whenever it is inflamed, whenever there are the conditions which are basically relating to the infectious state of the individual, as well as it can be any irritants in the environment that can cause the reddish discoloration of the conjunctiva. So it can be a simple hyperemia of the conjunctiva, which is not associated with any exudative discharge, any mucopurulent discharge. So the simple hyperemic conditions can arise in the conjunctiva like this. So it's basically the enlarged blood vessels, the apparent blood vessels in the conjunctiva that are quite common and that are usually commonly seen in the outpatient departments. And when you just look at the ophthalmology OPDs, you will get across a lot of patients having this kind of simple hyperemic condition. There are a lot of etiological factors. There are a lot of predisposing conditions which are the basic causes towards the development of the simple hyperemic condition. We have one of the variant as the acute and transient hyperemia. So it's not a chronic variety and it has a very short duration. So that's why it's named an acute and as well as a transient state of hyperemia. Over here, when we look at the etiological factors towards the development of this transient kind of ischemia, we have the direct irritants in the environment, which can cause such acute and transient hyperemia. First of all, we have a foreign body that can cause acute and transient hyperemia. It can be the misdirected cilia. So it's one of the causes in which the lashes, due to any causative factor, for example, it can be entropion of the lower lid, or it can be the entropion of the upper lid, which is causing such foreign body sensation. And finally, the transient hyperemia of the individual. Finally, we have a lot of irritants, for example, the concretions and dust particles in our environment, which can be serving as the irritative purposes of the conjunctiva and causing the final hyperemia and those apparent blood vessels at the conjunctiva. We can have the chemical fumes, smoke, or it can be a stormy wind. Bright light is one of the irritant as well, which can cause hyperemia, extreme cold and extreme heat. So it can be the extreme of temperatures. Both of these extremities can cause hyperemia of the conjunctiva. Bright light and exposure to the ultraviolet rays can again be one of the irritant purposes, which can cause such simple hyperemia of the conjunctiva. Now, these are the direct irritants which can cause conjunctivitis or which can furthermore cause the infectious states as well as the inflammatory conditions in this particular individual. And it can even simply, if they're removed, all of these irritants are removed, it can just end up in the irritative phase. We can just prescribe the patient to avoid all of these irritants. If they are the known irritants, we can just ask them to avoid these irritants and also add on or couple up this therapy along with the topical antibiotics and steroidal therapy. So this would be the direct irritants that can cause such a transient hyperemia. Then obviously the simple rubbing of the eyes with the hands, it can be even the irritant that can cause hyperemia in the individuals. Then finally, we have the systemic febrile conditions. That means that there is some sort of an inflammatory or an infectious state in this particular individual that he or she is suffering from, and that can cause the hyperemic conditions of the eyes. For example, it can be even the sinusitis, that is basically the acute sinusitis or the acute allergic conditions that can cause the transient and the acute kind of hyperemia in this particular individual. The non-specific inflammations, there are a variety of non-specific inflammations. Obviously, it can be the inflammatory conditions arising from the autoimmune disorders. For example, the Georgian syndrome and the SGS syndrome, they can obviously result, if they are of the milder intensity and one hasn't diagnosed the particular case to be suffering from any drug reactions or drug allergic reactions, but still there is a mild hyperemic conditions in the conjunctiva indicating the fact that this particular person is suffering from some sort of drug allergies that he has been using on. The reflex hyperemia is one of the kinds of acute transient hyperemias, and it's basically due to the constant eye strain. So it's usually found in individuals who are suffering from high myopia. So they're basically the short-sighted individuals. And usually due to the continuous eye strain, because the eye muscles are basically constantly straining due to the accommodative reflexes, the eyes basically are focusing on the particular object that the person wants to see. And that's why the eyes are in a particular straining phenomena. And finally, there would be an acute and transient hyperemia noted down in these individuals as well. Then obviously any local inflammations that are in close relation to the orbital cavity. For example, inflammations can pass on from the nasal cavity to the orbital cavity, as well as from the lacrimal passages, or if the lids are involved. And finally, even some of the infections can pass on from the orbital cavity to the cranial cavity, and from the cranial cavity vice versa. They can transfer on to the orbital cavity. So all of these cavities that are basically conjoined together, they can pass off the infections to one another. They are basically more prone to the development of infections in such a state. So all of these infections can pass on in this manner. Now, after considering the recurrent causes and the chronic causes of the hyperemia, one should know that what can be the causative factors towards the development of this recurrent or a long-lasting condition, which is basically the chronicity of hyperemia in an individual. There are a variety of etiological factors that are out there. It basically contains the chronic smokers. So one of the causes can be the chronic smoking habit of the individual, which can relate towards the chronic hyperemia of the conjunctiva. What can be the cause towards the development of this hyperemia? This hyperemia can be caused due to the smoke that is produced due to this habit, as well as it can be the nicotine itself. So the intake of nicotine can itself cause the development of hyperemia in the individual, because it will basically result in a kind of allergic sinusitis in an individual, and as well as the lacrimation can be sometimes seen along with this hyperemia of the conjunctiva. Secondly, we have the chronic alcoholics. So another chronic cause for the development of this recurrent or chronic hyperemia of the conjunctiva is the chronic alcoholism that can basically result in the hyperemia of the conjunctiva. Then we have the prolonged heat and dust exposure. So what can be the background factors for the development of this prolonged heat and dust exposure? It can be the occupation of the individual, which basically can resilient towards the prolonged exposure towards the heat and dust, as well as it can be some of the systemic factors. For example, if the patient is suffering from hyperthyroidism, he's going to have proptosis of the eyeball, which basically means exophthalmos, or that is basically the external protrusion of the eyeball, and that is basically making the exposure of the conjunctiva towards the dust particles and towards all of the irritants that are present in the environment. So it can be the person himself or herself, which is basically making him or her more prone towards the exposure of dust and ultraviolet rays, as well as it can be the environmental conditions as well. So then we have the acne rosacea. So if there is some sort of a local inflammatory condition of the skin, it can even result in the inflammation or in the reddish discoloration towards the conjunctiva, which is basically the hyperemia of the conjunctiva. Then finally, the insomnia, that is the lack of inability, that is basically the inability to fall asleep is basically termed as insomnia, and that is another factor towards the development of hyperemic conditions of the eye. Again, all of these factors, if you just look at quickly, comprehensively, look at the causative factors towards the development of this recurrent cause of hyperemia in these individuals, you'll just notice that all of these factors are chronic themselves. That is basically the chronic smoking habit or the chronic alcoholism or insomnia. All of these are the chronic conditions that will be prevailing in the individual. Again, over here, we're going to focus on the fact that the history taking is very important. A complete and a detailed history of the individual will reveal the facts that if the person has the habits of chronic smoking, chronic alcoholism, he or she is suffering from insomnia, or is he exposed to heat and dust at prolonged periods of time or not. The clinical features relating to the simple hyperemia of the conjunctiva would include the feeling of constant discomfort in the eyes. So the patient would constantly complain of the fact that he or she is having the feeling of discomfort, although it's not the painful feeling that he has, but it's a constant discomfort, a foreign body sensation in his eyes that he would complain of. Then obviously the grittiness in the eyes or the heaviness would be the second complaint. It would be coupled upon with the tiredness. So the chronic fatigue would be sometimes coupled up along with this simple hyperemia of the conjunctiva. Tightness in the eyes would be another complaint, and there would be mild lacrimation. Now, one has to distinguish this fact over here that basically whenever we have cases of viral, bacterial, or fungal conjunctivitis, they have that mucopurulent sticky discharge coming out of the eyes. So it's just not the hyperemia of eyes. This hyperemia in the infectious states is usually coupled up along with the discharge that is mucopurulent, and again it's the stickiness of the eyes, and that would be basically diagnostic of the fact that this patient is suffering from some sort of an infectious state in itself rather than just the simple hyperemia of the conjunctiva. Over here it would be just a mild lacrimation phenomena. It would be just indicating the fact that the person's conjunctiva is irritated due to some of the environmental factors, whether it is dust, the extremes of temperatures, or it is the ultraviolet rays that are causing the irritative purposes in this particular individual. So this is basically how you distinguish between these two cases. Then minimal mucoid discharge is sometimes seen, and when it is seen, it means that there is a superimposed infection. The simple hyperemia of the conjunctiva would never have a mucoid discharge, but if it is a prolonged case of simple hyperemia of conjunctiva, then only it can be coupled up with the superimposed infections, and that would sometimes lead to this minimal mucoidal discharge, and again, it would be sticky in nature. Then finally, the patient would complain of congestion, more marked in the pharynxes, obviously, and that would sometimes result in lacrimitis, or sometimes it would be involving the nasolacrimal sac and the nasolacrimal duct as well. Now, how do you treat these cases of simple hyperemia? If it is a known factor, that is the irritant is known in an individual, if it is the dust or if it is the prolonged exposure to the ultraviolet rays, that is sometimes the sunlight, and then we have the extremes of temperatures, then basically you have to avoid these conditions in the individual. You have to eliminate these irritative factors for the individual, and the treatment would be obviously, as I've already mentioned, the fact that you have to remove the cause first of all. Topical decongestants are given along with this factor. These topical decongestants would include 1:10,000 adrenaline drops as well as the nefazoline drops, which has the decongestive properties as well over here. So this is the whole treatment in which, first of all, we have to supportively remove the cause, as well as we can couple up this therapy with topical decongestants. If there is some sort of a superimposed infection, we can treat that as well. Now, moving on to the other symptomatic factors of the conjunctiva, it basically includes the chemosis of conjunctiva. The word chemosis basically relates to the edematous conditions of the conjunctiva, which is basically, as you can all see over here, this is the inflammatory condition of the conjunctiva, in which you can just observe the swelling, the redness, the hyperemia is coupled upon the edematous condition of the conjunctiva. Now, this edema can be caused due to the infiltrates that are collecting at the site. So there are a lot of etiological factors towards the development of this edematous chemotic conditions in the conjunctiva, ranging from obviously the infectious states. It can be the autoimmune disorders, it can be a lot of allergic conditions of the conjunctiva, which sometimes present as the edematous condition of the conjunctiva, which is also termed as the chemosis of conjunctiva. So this is basically how you relate to this kind of a symptom. There are the local inflammatory conditions, first of all, that would basically include conjunctivitis. This is one of the causative factors towards the development of edema in the conjunctiva. It's basically the collection of infiltrates whenever this edematous condition, or whenever there is a state of infection or there's a state of inflammation. For example, conjunctivitis, which can be again caused due to multiple causes. It can be bacterial, fungal, viral. It can be even related to the autoimmune disorders, or on the other hand, it can be the allergic conjunctivitis, it can be the cicatricial conjunctivitis. So all of these causative factors which are ending up in the infectious state of conjunctiva can relate also to the edematous phase of the conjunctiva. Then we have corneal ulcers. So any infectious state, for example, it can be the punctate keratitis, or it can be the keratitis, which is coupled up along with the conjunctivitis. All of these can finally result in the corneal ulcers, and these corneal ulcers can finally result in the edematous condition of the conjunctiva. On the other hand, we have fulminating iridocyclitis. So if it is the infection of the iris, The muscular iris is involved, along with the pupillary infection, along with the infectious states of the anterior chamber. All of these would again result in the infiltrates to accumulate at the subconjunctival level, and obviously giving the picture of edematous condition of the conjunctiva. Then we have endophthalmitis. Endophthalmitis is basically whenever there is the infectious state which is involving the conjunctiva, the sclera, the cornea, and the anterior chamber. So it's basically a fulminating picture. And even then, there is the edematous condition of the conjunctiva which can occur. It can be the panophthalmitis involving the anterior chamber as well as involving the posterior chamber of the eye. That is, the vitreous humor as well as the aqueous humor are in an infectious state. It is the wholehearted infectious condition of the eye, and that would certainly result in the inflammation of the conjunctiva. Then obviously styes, chalazions, blepharitis, all of the lid infections can also relate to the conjunctival inflammation or conjunctival edematous conditions in an individual. Finally, we have acute meibomitis. Meibomitis is basically the infections of the meibomian glands. So it can be the glands of Zeiss, it can be the meibomian glands. All of these glands can be involved in the infectious states, as I've already mentioned. It can be the lid infections, it can be the infections related to these glands, which can move on and picturize as the inflammatory conditions of the conjunctiva, and obviously the swelling and the chemosis of the conjunctiva can result. Then obviously even it can be the paraorbital infections, or even it can be the orbital cellulitis itself, which manifest as the edematous condition or the chemosis of the conjunctiva. The acute dacryoadenitis. Again, the word dacryoadenitis is basically relating to the fact that it's basically the infectious state of the lacrimal gland or the lacrimal sac, which is giving out the final picture of edema, or it is giving out the final picture of chemosis in the individual. The dacrocystitis is another infection which can relate to such edematous conditions. And then we have tenonitis, that is again relating to the canaliculi, or it can be the lacrimal sac itself, and all of these infections, and even the infections from the nasal cavities, from all of the surrounding cavities can sometimes, even the sinusitis can sometimes result in the edematous conditions of the conjunctiva. So all of these local inflammations can give out the final picture of edema of the conjunctiva in the individual. Then obviously we have the local obstructions. There are these are basically the causative factors that are resulting in the local obstruction, and finally giving out the edematous picture, the chemotic picture in the eye. Cysts, then we have the endocrine exophthalmos, then we have the orbital pseudotumors. We have the cavernous sinus thrombosis. That is one of the factors towards the development of the local obstruction. That is basically the venous congestion is caused due to this cavernous sinus thrombosis, and that would result in the edematous condition of the conjunctiva. Then we have the corticocavernous fistulas. You can consider these fistulas to be just the kind of the arteriovenous fistulas that is seen, and it is one of the causative factors towards the development of the venous congestion in these individuals as well. It's a type of the AV fistula. Then obviously we have the blockage of the orbital lymphatics following the orbital surgeries. So sometimes the venous congestion, and on the other hand we have the lymphatic obstruction that is resulting and giving the final way of the swelling or the edema that is being caused at the subconjunctival level. Then finally we have the acute congestive glaucomas. So it's one of the variants over here. Glaucomas, the angle closure glaucomas, and even the open angle glaucomas can sometimes result in this congestive picture or even the edematous picture of the conjunctiva. Then, on the other hand, just beside the local inflammations, besides the causative factors towards the development of the local obstructions, there are the other causes, which are basically the systemic causes, which can picturize or give the picture of edematous conditions in the conjunctiva. Severe anemia is one of the factor. We have hypoproteinemia, which is one of the basic causative factors over here. When basically you will have to get along with the lab investigations. These are very important. The history taking is very important over here. And on the other hand, you will be focusing on the lab investigations of the patient as well. You'll be asking for the HB of the individual, the complete blood picture of the individual, and then obviously the ESRs, that is the erythrocyte sedimentation rates. All of these would be considered over here. The congestive heart failure is again very important over here, and then we have the nephrotic syndrome, which is which can be one of the causative factors towards the venous congestion, as well as the congestive heart failure, that is the CCF, is basically also resulting in the venous congestion and the final edematous picture of the conjunctiva. Then we have urticarial pictures, which are seen, that is basically the allergic reactions, and they're focusing on the allergic reactions. And sometimes along with the skin manifestations, they have their ocular manifestations as well. Finally, we have the angioneurotic edemas, and that these angioneurotic edemas basically can result to a lot of drug interactions. A lot of drug allergies can sometimes result in this kind of a angioneurotic edematous picture in the individual. The ecchymosis of the conjunctiva, this is basically how it looks like. It's quite a strenuous picture, and it's quite a horrifying picture for the individual. Usually the patients would come up to you in the emergency departments complaining of this sudden appearance of ecchymosis at the subconjunctival level. This is a very horrific picture because it's basically indicating that there is some sort of a hemorrhage at the subconjunctival level, and that's true. Basically, it's the hemorrhage that is occurring at the subconjunctival level, and there are multiple causes towards the development of this ecchymosis in the subconjunctiva. But you have to consider this fact that counseling of the patient is very important. It's a self-limiting condition. You have to counsel the patient that it cannot be treated along with some topical use of eye drops, any antibiotics, any steroids. They're basically of no use in this kind of a condition. This condition is not usually infectious. It's not usually superimposed with infections, and so it's you just have to let alone the patient and ask him to just relax and just carry on the investigations in this individual, just to see if there are any systemic conditions that the patient can be suffering from. What can be the systemic conditions in this particular kind of patient? Either it can be that the patient is suffering from a long chronic condition, for example, diabetes mellitus, or even hypertension, even hyperproteinemias. All of these are the systemic conditions which can result in this kind of ecchymotic conditions of the conjunctiva. So this is how you basically deal with this kind of a condition, which you will notice in the emergency departments, and the patient would usually come up to you with such sorts of subconjunctival hemorrhages. Now, moving on to the etiological factors towards the development of this sort of the ecchymosis of the conjunctiva, we have the conjunctival inflammation. So there are a lot of inflammatory conditions which can result in this sort of ecchymosis of the conjunctiva. Just enumerating the facts, we should know that it can be the picorna virus, it can be the pneumococcal conjunctivitis, as well as it can be the leptospirosis. So all of these are the inflammatory conditions which can arise in the conjunctiva, and all of these infections usually give way to such an ecchymotic picture of the conjunctiva. They're usually associated with the acute hemorrhagic kind of conjunctivitis in these individuals. Then there are a lot of conditions in which basically there is the venous congestion. These conditions would include the whooping cough. We have the epilepsy, strangulation, the compression of the thoracic cavity. All of these would result in the congestion of the venous outflow of the head and neck. So that would be basically causing the venous congestion in the eyeball and resulting in such ecchymotic conditions of the eye. So this is basically very important to take the history in detail from the patient, and that would reveal the facts whether there was any strain on the thoracic cavity or on the neck of the individual, whether there was any history of strangulation. All of these are very important to focus upon over here. The sudden venous congestion of the head. All of these relating conditions would result in this kind of a picture. Then obviously trauma. What kind of trauma? It can be even any environmental trauma, or on the other hand, it can be any surgical trauma as well. For example, it can be the retrobulbar injections, which sometimes lead to this picture of the ecchymosis in the conjunctiva. So this is very important. Again, history taking and examination of the patient is very important over here. The local trauma or the retrobulbar hemorrhages, they are very significant, and we have to focus on these facts as well. Then obviously there are a lot of blood dyscrasias which can result in these conditions. For example, anemias, it can be leukemias, and as well as it can be the dysproteinemias, which can result in this kind of a picture. Then we have the bleeding disorders like the purpura. So it can be these sorts of bleeding disorders, and as well as we can have the local vascular anomalies, and these local vascular anomalies would basically include the anomalies which are the by birth anomalies, for example aneurysms. It can be the telangiectasias, it can be the angiomatous tumors that can sometimes result in this kind of hemorrhagic reactions at the subconjunctival level. Spontaneous rupture of the capillaries sometimes occur, or it can be sometimes related to the acute febrile systemic infections. And on the other hand, we have the vicarious bleedings with menstruation. So sometimes it is related to the menstruation, but obviously when you have this patient of ecchymosis at your hand, you should know how to investigate and manage these cases. The management is obviously, as I've already emphasized on the fact, it's a self-limiting condition, but you have to investigate for any systemic causes, any birth anomalies that are present in the individual, because that is very important, and that is the mainstay of such cases of ecchymosis at your hand. The clinical features would include the flat sheet of homogeneous bright red color. In traumatic type, the posterior limit is visible. So it's again very important when you have that retrobulbar injections being given upon surgeries, you will have that posterior limit quite visible in these patients. And then on the other hand, we have to focus on the fact that it's basically a self-limiting kind of a condition. Mainly it is absorbed within 7 to 21 days, or that is basically, in other words, it's almost 3 weeks that it would take to self-resolve the condition. Some pigmentation may be left. It would be a yellowish pigmentation that would be left in these individuals, but it can go off along with the time. There are no risks for any superimposed infections as well in these conditions or in these patients. So the reassurance and educating the patients is very important over here. The treatment would consist of any placebo therapy. If the reassurance didn't work in this kind of a case, we have to give the placebo drug with astringent eye drops just to avoid, and then the cold compresses to check the bleeding, and then obviously the psychotherapy and the assurance of the patient is very important. Moving on with the other symptoms that can occur at the conjunctiva, we have xerosis. Xerosis is basically the dryness of the conjunctiva that can occur. Now, this cirrhosis can basically, or this dryness of the conjunctiva can occur due to the destructive causes, as well as it can be the exposure of the conjunctiva. The prolonged exposure of the conjunctiva usually results in this kind of dried out conditions, which usually do not occur in the normal states. Again, the patient would complain of the heaviness in the eyes or the discomfort that he would be complaining of. On one hand, we have the parenchymatous xerosis, and whenever we have this parenchymatous xerosis, they are basically of two major kinds. We have the destructive interstitial conjunctivitis, as in, for example, trichomatous conditions, that is basically a sexually transmitted disease. We have Stevens-Johnson's syndrome, that is basically a drug interaction that takes place, a drug reaction or a hypersensitivity type 4 reaction that takes place after taking a certain drug only in certain individuals. Then we have pemphigus vulgaris that can occur in a lot of individuals. The exposure of conjunctiva to the eye. Now, why does this exposure occur? There are multiple causes. It can be the proptosis. It can be the facial palsy, the ectropions that can occur in these individuals, the lack of inability to just close the eye, the lag of thalamus. All of these are basically the conditions which can predispose towards the exposure of conjunctiva to the air. And that is basically, these are the conditions which we have to focus on whenever we are taking the history and whenever we are investigating a particular case of xerosis in the individuals. The epithelial xerosis would consist, it can be due to the hypovitaminosis, A, and in association with the night blindness, the patient as a part and parcel of the xerophthalmias. The clinical features would consist of the epithelial xerosis. Typically, it occurs in children, and the degree of the conjunctival dryness and thickening is also noted down in these patients. Along with that, there would be a wrinkling and a phenomena of depigmentation noted down. The treatment would consist of the artificial tears, of course. We have to basically consider giving the artificial tears, which basically means giving out the methyl cellulose, or we have the hypomethyl polymerase alcohol, which is given as the artificial tears in these individuals. One of the other symptoms of the conjunctiva that are noted down are the discoloration that is noted down. As I've already focused on the fact, there can be the edematous condition. And on the other hand, we can have the redness or the reddish discoloration of the conjunctiva. All of the conditions of the conjunctiva that we have discussed, whether it is the conjunctivitis caused by the bacteria, viruses, fungal infections, trachomatous conditions, allergic, cicatricial conjunctivitis, all of these would give this reddish discoloration to the conjunctiva that are basically indicating that the conjunctiva is irritated or it is inflamed. Then obviously there can be the subconjunctival hemorrhages that give out this reddish discoloration to the eyes. Then finally, we can have the yellow discoloration of the conjunctiva, like this. So whenever you want to examine the conjunctiva of the individual, you ask the patient to look in all of the cardinal directions and you observe the conjunctiva on a whole. Whenever you observe that there is some sort of a yellow discoloration, the differential diagnosis would include the jaundice, it can be the yellow fever, or even it can be the malaria conditions that sometimes result in this yellowish discoloration of the conjunctiva. Then finally, the grayish discoloration can sometimes be due to a lot of pigments. It can be due to the eyeliners or the kajals that are basically sometimes used by the patients so that they give a dark grayish discoloration to the conjunctiva, which is a misnomer basically. Then we have the brownish gray discoloration. So this is basically also known as the melanocytes that are sometimes present, and they give out this condition of the brownish gray discoloration to the conjunctiva. The blue discoloration is sometimes due to the thinning of the sclera. So the scleromalacia is a condition which is associated with this bluish discoloration that is usually seen in these individuals. So we have to note down or we have to jot down all of these differential diagnoses, and then we'll just further investigate the case, whatever the discoloration is. And then finally, we'll move on to the definitive diagnosis in these individuals, and obviously the final managements or the treatment guidelines that are given out for these individuals. Then obviously we have the melanocytes, or it can be the melanomas, that give out the brownish pigmentation to the conjunctiva. The brownish pigmentation can be non-melanocytic pigmentation, that is basically the endogenous pigmentation in these individuals, and on the other hand, it can be the exogenous pigmentation as well. And then we have the melanocytic pigmentation. We just have to keep in mind that whatever the case is, whatever the discoloration is in these individuals, we just have to focus on the fact that these individuals have to be investigated in detail. The investigations would start off with the history taking. A complete history taking is very important. A complete examination along with the systemic examination is very important, because that would reveal any cases of anemias or deposited bilirubins, diabetes mellitus, hypertension. Even the general physical examination would reveal all of the factors in these individuals. So the detailed examination is very important whenever we have these patients at our hands. The conjunctival epithelial melanosis is important, subepithelial melanosis, and then we have the pigmented tumor. So it's not always a benign case. Whenever we have the brownish discoloration, it's just not always a benign case. It can be the pigmented tumors that are occurring at the conjunctival level. So over here in this lecture, we just summarize the symptomatologies that are revolving around the conjunctiva. What are the different clinical features that we have to focus on whenever there is some sort of an edema that is noted at the conjunctiva? Either it is the discoloration that is given out at the conjunctiva, the chemosis or the ecchymotic conditions that are occurring at the conjunctiva, and what are the predisposing factors or the predisposing conditions, as well as what are the treatment guidelines towards the management of such cases are discussed over here. So that is the end of this section. Thank you for watching sqadia.com.